Thanks, Elizabeth. Appreciate that. And so we've got about 30 minutes. Going to tell you what the second question is going to be is how do you see liberty and justice reflected in your work? Because you each have very different and interesting employment. But let's first start with what does liberty and justice mean to you? I'm an attorney, so to me it means freedom and fairness, kind of the shorthand. But you've all got different contexts, so we'll start with you. Tell me about how you define it, and then we're going to get to, as we go back through, how it relates to your work.
Sure, I think that, again, when I think about liberty, it is really about freedom. Freedom to be able to speak, learn, act, dream, set goals for your life without restraint, without oppression. When I think in terms of justice, I think the equal opportunity and the rights, civil rights that we should all have. And it's being equitable and fair.
Adriana?
Yeah, I love freedom and fairness. I think for me, the word that pops up is access. You know, the access that everyone has to that freedom and fairness. And as she was saying about equity, and I think it's the ability for everyone to have the opportunity to thrive and live their best life.
Great, thank you. Betsy?
Yeah, I think freedom from, and freedom to really encapsulate for me liberty, and along those lines the access, and justice is really the interweaving around the interconnectedness of how we uphold the relationship between those two things and the balance of how those two things happen in community.
What freedom to and freedom from? Why don't you explain that?
So I think about, you know, if I'm walking down the street and I have the freedom to walk without stepping on something, that means that I have the freedom to walk safely. It means that also that I have the freedom to, the freedom from walking without things falling on my head. So what are the conditions that have to kind of exist on that sidewalk, around that sidewalk, with the people walking around me, with the things in that neighborhood? All of a sudden within community, we are all operating in a relationship and a network and in a community so that my freedom from and my freedom to and everyone else on that sidewalk are operating in concert and relationship with each other.
And Trey? Liberty and justice.
Tell you what, this is April Fool's joke is on me. It's gonna be hard to go after you guys. I'll say hope and stewardship. And what I mean by hope is the ability of each individual to seek out their creative expression in commerce or whatever methodology that might be. And justice I think of as stewardship, because in America today, there are the few making the decisions for the many, but the many have the opportunity to be involved in the decision making through choosing who our leaders are. So, yeah, hope and stewardship, but freedom and fairness, I think, rings true for me as well.
Let's start with you then on the how do you see it reflected in your work in communities?
Definitely. I mean, I heard about this about 30 minutes prior, and I just so happened that I collected one of these. These are hanging oyster gardens, so I'll just go ahead and use my prop right away. Phone a friend, right? So these are going to be placed primarily in the Reebok and Trout rivers as a means of filtering out pollution, because Trout River and Reebok River are vulnerable to pollution and erosion, you know, when storms come in and things like that. And these are areas that are predominantly black areas after people had transferred their homes from the Sugar Hill area over into the north side. And so this part of the watershed is something that is being, I guess, managed and salvaged to a degree by programs like Resilient Revolve, which is through LISC and St. John's Riverkeeper. And I think it's really important because back to that stewardship, it allows people who have property still there to put these on their docks, and there's something called POSH modules that help the shoreline. And so just a level of empowerment, again, which brings hope.
Great. Betsy, as the founder of the Center for Children's Rights, you talked about restorative justice. Why don't you explain how that fits into liberty and justice?
Yeah, so Restorative justice is a practice that really recognizes our interconnectedness and the relationship that we all have with one another. And so at CCR, we really use young people who are at risk of and involved in the juvenile justice system as both a lens and a mirror for us as a community to think about how we are operating in our relationship with our young people in community. Like, how are we really doing with their access to the things that they need to thrive? How are we really doing as a community so that every young person has those things, those pathways, the kind of shared opportunities, so that they have the equitable chances to dream and the pathways and possibilities and opportunities to kind of misstep and mess up along the way. And so restorative justice recognizes that we're all in relationship with one another, and everything that we do is interconnected. And that we're all gonna make mistakes in our relationships. We're all gonna make missteps, and that the best thing that we can do when we make missteps or mistakes is figure out how to make it better. And usually the best way to do that is to make it better directly to the person or the people or the community that we've harmed or impacted. And so one example of that for us is when young people mess up, we really try to give them an opportunity to make it better directly with the people that they've impacted or directly in community. And you know, when we think about ideas of liberty or justice, restorative justice is a good kind of opportunity to be able to make mistakes and make it better in community in a way that keeps the balance of that freedom to and freedom from when we think about how we're all negotiating that, in a way that doesn't necessarily have to rely on a justice system, or in a way that can be complementary to the other justice or existing systems. And that also really recognizes that every one of us in this room has the ability to be a part of holding up all of our agreements to one another about how we're keeping our communities safe and healthy and whole, and places where every young person, every person really has a chance to thrive.
Thank you. Adriana, you're an economist, so you measure things. So how does this concept from freedom and justice, liberty and justice for all, apply to you?
Yeah, you guys can't hear me. Like every time you're talking, I'm like, like it's so good. And we all actually like each other, so this is super fun. So I'm an economist, and I would say it shows up in my work because I actually get to analyze and measure, I would say, the structural barriers to liberty and justice, right? So economics is a science. I have chosen to apply that science to wealth and race and education. Honestly, a lot of the issues I saw that plagued, my people in Jacksonville, and how those things intersect. So it's really fun for me because I think a lot of times we get lost in the what, and I'm able to step a little higher and really think about the why. And I think when you get to the why, that is the root cause of real change. And being able to, I tell people all the time, like, civic engagement has been my superpower. And I know that we're gonna talk later about really getting tapped in, but being able to bring that more, analytical research, economic perspective, even to organizations that I love, I think has increased our ability to measure true impact and push and drive Jacksonville forward.
Let's go ahead and go into the tap into
Okay.
that you referenced. Yeah.
Tap in is my word. You gotta tap in. Okay. For me, I started, when I came back to Jacksonville after, graduate school, I really wanted to get more involved in the community. My parents were pastors, just grassroots was just my thing. And it was something about getting out of the house on a Saturday and stop thinking about myself for a moment and thinking about our community. And it became a way that I got to meet new people and learn about new issues, and bump into people like Betsy. It's like, oh, you're doing amazing work. I'm doing amazing work. Let's do amazing work together. And I think it's a shared responsibility. Sometimes even now, we can have a heavy weight when we think about everything that's going on. But when you remember that we're absolutely all in it together, it makes the load a little lighter.
Okay. Monty, you do health, disparities in health outcomes, and so why don't you kind of explain how liberty and justice applies to you and your work?
Sure, I think that when I think about what liberty really means in healthcare, I think that I think about the autonomy to make decisions about your own health, the autonomy to make informed consent, and also having confidential information. And then when you apply that to the justice aspect is having those resources and access to those resources so you can have the best outcomes. So when I think in terms of health equity is, we should all have access to the best care that we could have. We know that we don't necessarily have, and we can talk about specifics on this community here, but there are inequities. And I think the work that we do is to try to identify some of those deficiencies and then figure out how we can create those collaborations with community organizations, with other healthcare organizations in town to be able to provide the care to the community that really needs the care. So I think that's the way I see that.
What about the flip of that, where the absence of liberty and justice?
So that's where the inequities and the disparities happen. So if you think in terms of the best outcomes for the health of an individual, really is not just determined by the care that they receive or not. So for an example, 12% of the population in Duval County does not have health insurance. And we have, add to that, about 25% of the population that has what we call underinsurance, which doesn't necessarily cover all the costs for them. But the healthcare alone is not necessarily the only thing that's going to provide the good outcomes. It is the social determinants of health, what we call access to nutritious food, that's going to get that individual to be able to provide to their families good nutritious food, access to transportation, safe housing, and I could go on, the ability to pay their bills, and the ability to get the education that their families have. So I think the barriers to justice and to the liberty of having a lack of access. So one of the things that when we did a community health needs assessment recently, right? The major thing that was identified was access to care. People do not have the access to care that they need, and they also don't have all the other social determinants of health that's needed to provide good outcomes for the individual.
What's your theory on who should pay for that insurance or that access?
I think the issue is very complex, right? We cannot just consider that who should and should not pay for that. You need to consider all the other social determinants of health. For you to fix the issue of health insurance is not enough, because I can have the access and be able to go to that physician, but I might not have the transportation to go to that appointment. I might not have a safe housing, and I live in a very violent district, or I don't have access to the good food and nutritious food that I need. So I think when we talk about how do we increase the health of the individuals, you can't just think of one aspect of that. You need to think about the global and the whole complex.
Adriana, you seem to kind of reference the same thing.
Well, I think she answered it perfectly. I think it's complex. And it's almost like we have a saying, like we're trying to boil the ocean, and I think sometimes doing what you can do is the best thing, and I find that a lot of times, like Betsy and I are working on some health initiatives now, it's also internal, like the support that our nurses and doctors have, and the support that our different healthcare communities have. And transportation has become a big issue in Jacksonville. Like, we are a major city. And I know that even at Ascension St. Vincent's, I sit on the foundation board, just something as simple as giving someone a voucher for the bus, to get to their doctor's appointment, and major appointments and major healthcare issues, And so we're trying to boil the ocean, but again, it's a responsibility on all of us to do what we can do.
Yeah. Transportation, I think, is an under-discussed issue because the vast majority of us have cars, but for those that don't, it's a crippling thing, whether it's to get to a doctor or a hospital or get to work, to be able to have the money to or have insurance. So Betsy, you then on lack of, how does that fit sort of the kids that you're working with and looking out for?
Yeah, I think, to kind of this discussion, it's not surprising that poverty is often a direct pathway into the juvenile justice system. I think what we see is that every day, families and young people, just like all of us in this room, are making the best decisions with the best that we have available, right? And so as kind of, if we think about this idea of liberty as our array of choices becomes smaller, the best choices that become available become less, right? And so if we as a community can really start to think about how do we increase and really come together to think about and be really intentional about how do we increase the best number of choices available, right? If we're thinking about from a social determinants of health perspective, from a transportation perspective, or from a housing perspective, how do we increase the best number of meaningful, best choices available? And how can we come up with some really hyper-localized solutions to do that, right? Because I think often, kind of to Adriana's point, we have this idea that there's some master plan that's gonna solve it all. And I don't, I've been kind of doing social work for a long time, and I've been lawyering for a long time, and I've worked in lots of different communities in lots of different states, and the best solutions that I've often seen have been lots of times the smallest, right? Have been developed around small tables or around small neighborhoods or among small organizations or among the people who are the most proximate to the issue, who have the most expert knowledge, because they can really say, hey, we've been here and this is really what's gonna work. And we've seen that with the young people that we work with. I'll give a perfect example. We work with a young person who we recently became involved with, and he's making decent enough grades, but kind of with all the stakeholders in the system who work with him, nobody had ever really asked him what his individual goals were. And so when one of our team members got involved, they asked him, what's your goal? What would you like to work on with us? Because that's one of our priorities or values, right? Kind of from a liberty lens. You have agency, you have choice. What would you like? And he said, I want to work on school. And so when we asked him what that
work on what?
school, we're like, that's kind of interesting since you're making passing grades. A lot of times our kids are not making passing grades. And when we dug into that with him, it turns out that this young person, to this point of transportation, had been taking the city bus for like 5 years. He was a part of a Spanish-speaking family. They did not feel like they had access to communicate with the school to figure out setting up public transportation, so he was chronically late and picking up truancies and absences, and it was impacting his grades, and it was, in the end, a simple thing to fix, right? With some support and advocacy and connecting him to the right people, and he was empowered to do it. But without kind of the connection of the ask and the support and the resources, he might never have been connected to the bus. And so I think that's kind of the point, is sometimes we get fixated on the answer and not the questions.
And the issue, I guess, is how you scale it up, it's when it's a one-on-one. Let's stick with education for just a minute. My mother used to say, if you can read, you can do anything. And my first career was as a prosecutor, and it was rare to prosecute somebody for a felony that had a college degree. I mean, really, really rare. So why don't you talk about education for a minute, and we'll go to Trey with the same kind of thing.
Yeah, I think education is really, really important, and I think, kind of along those lines, there's a lot of really good conversations in our community right now about education, and a really great opportunity for us as a community to really come together and think about where are our values and priorities in education. And I think the one thing that I always like to really remind folks is that learning is relational. And so we can put all of the curriculums into schools, we can put all of the things into schools, but kids learn best in relationship, when they feel safe, when they feel We need the kids to experience that. We need the teachers to experience that. We need the administrators to experience that. We need the janitors to experience that. We need the cafeteria folks to experience that. We need the school safety guards to experience that. We need every level of the adults and the young people in that school to really be experiencing that, for it to really be an academic environment where every student is able to thrive and be learning at their highest level. And I think that once we as a community can really include that in the conversation, we're really going to have an opportunity to take our reading and academic and educational goals kind of to the next level.
Trey, you have thoughts on that? Or, you know, kind of the question began, not everybody has to answer the exact same thing, is the absence of liberty and justice.
Well, I actually would like to dovetail off of what Betsy mentioned and the rest of the panelists, because I wrestled it from the other end. You talk about agency and choice and access to information, but there's also self-accountability and desire. And there are people who are coming from similar backgrounds. I'll use my family, for example. You know, my sister and I are in a very different place than my first cousins. And I think that exists throughout a lot of families, where there had to be some type of programming that we received that was catered towards certain types of choices. And obviously with legislation and different things that have happened throughout the past, there's programming that goes the other direction, and it comes from the arts, film, music, not just legislation. And so one of the things I really think about is, and maybe I don't know all the numbers and stuff like that, but I think about, you know, what is it that makes somebody seek out this information because it is available, and sometimes it is gatekept, but not to a degree that there aren't examples of people who have, you know, cross that bridge where they sought out the education they need through the transportation that they need. They just had a grit and a desire to them, and I'm really curious about, I don't have the answer to where that exactly comes from, and I would assume mostly familial, but sometimes it's not. Sometimes there is zero family support, and that person is able to get it out of the mud and tap in, to use Adriana's word, you know, to get into these spaces where they have a college education and they're not on that prison, you know, school to prison pipeline.
Yeah, there's a book by Leon Dash. He was a Washington Post reporter. He's since passed away. And he studied an inner city Washington, D.C. family, just tons of tragedy. 8 children to one mother. She was involved in prostitution, got one of the kids hooked on heroin, taught her grandkids how to shoplift. I think it was 8 or 9 kids. And it's just horrifying. And you wonder, how can anybody come out of that? But 2 of the boys did. 2 others were on death row, and the conclusion was, at a critical point in those kids' lives, kind of the example that Betsy gave, a role model stepped in. A teacher, a coach, a guidance counselor, and a sergeant in the Army. So it's doable when you get to the scale. So come up to you, Adriana. Take it from there.
Ooh, wait, take it from where?
Well, you know, you had referenced before the lack or the absence of liberty and justice.
Yeah, so you're asking me how it shows up in my work?
Yes.
Okay, I think my work tends to fall heavily in diversity, equity, and inclusion. Still, I ran a program at UNF for a while and just got connected to really the students' secondary to post-secondary transition, which is kind of what you guys are talking about, right? That post-high school, what are you gonna do now type of thing. So I work with several organizations in the city that are pushing that type of work. I find, and I still teach at UNF, so I guess I wanna say the youth are keeping me young, but I'm still relatively young. But for me, it shows up in, you know, what am I passionate about? I'm passionate about equity, I'm passionate about education, I'm passionate about, you know, how do we keep amazing people doing great work, you know, supported and their arms lifted up. So I think that's how it shows up in my work.
Bonnie, in the healthcare arena that you're in?
I think that a lot of the work that we try to do is really centered in connections and sense of belonging, making sure that people feel supported and have the resources. So again, translating that into patient outcomes, you need to make sure that the people supporting those patients, the physicians, the clinicians, the nurses, the people that are providing the care also feel supported, feel that they are valued for the work that they do, feel that they're respected for the work that they do, feel that they have opportunities for growth professional growth, and you would translate that in the outcomes or whatever, not just healthcare, but I think, talking about the education, the support for the teachers, for the caregivers, and the individual that made a difference in someone's life, because it could be that physician, it could be that clinician, it could be that teacher that is making a difference. So by supporting those and having them feel like they belong in that space, that they can thrive in that space, will reflect in a positive outcome.
Okay, what could an individual or a community do to advance how you define liberty and justice? What can they do?
Advocacy, learning, I think learning in community, learning about how your life interconnects with the life of others, and that your reality and your lived experiences could be very different than someone that's sitting right next to you. And not expect that the privilege and the experience and the resources that you have, that individual also has, because they most likely don't. So I think that learning, the self-learning, and then awareness. So once you learn that for yourself, making sure that that awareness and that education can be passed on so people can understand that my lived experience is different than yours, and if I'm able to support the individual that's next to me, that person can be that person for someone else. And then that's how you build community.
Adriana, what can an individual community do? You've kind of talked about it, but yeah.
Yeah, I mean, look what we're doing tonight. We're going to engage in conversations at the tables in a little while where we're going to learn from people that are different than us, that, come from different backgrounds. And I think that community engagement of getting people out, talking and learning and growing about the issues and what we can do to come together is really important. I like to tell people to a lot of times get closer connected to their actual community where they live, where they, are every day, that local church, that local school, the local nonprofits, doing great work. You don't always have to go to the other side of town. There's someone doing amazing things within 2 to 3 minutes of you, if you kind of open your eyes and really get connected. And also,
In my case, they're within 2 to 3 feet of me.
So I think just do something. A lot of people are like, what do I do? What do I do? Start somewhere, and then you'll find your journey along the way.
Trey?
I would say the phrase, 1 can put 1,000 in flight, 2 can put 10,000 in flight. So capacity building through collaboration. There are people that can be reached in better ways by one organization, and then financial contributions made by another organization, where if we can create an ecosystem of that, where people are trying to accomplish the same thing and really connect those people out of those silos, that's going to go a long way. And to Adriana's point, that's kind of what we're doing here today.
Betsy, go to you with that one then.
I think start by going outside barefoot and just feel the ground and start where your feet are. And then build your table of your neighbors or your friends or your family. And then think about a memory of yourself as a kid, of yourself at 12 or 13 or 14, and try to hold on to that, because there are kids and young people in our community and across the state of Florida that really need you to remember what it's like to be a 12 or a 13 or a 14-year-old, and to remember that 12 and 13 and 14 and 15 and 16 and 17-year-olds really need the opportunity to make mistakes and to have second and third and fourth and fifth chances, and that they need to learn in community, and that they need to learn in community with all of you.
Marty, with you, are there groups today where you specifically see a barrier to that liberty and justice concept?
Yes, I think that goes back to what I was saying about lived experiences, right? There are underrepresented groups and marginalized groups that are not getting the benefits of liberty and justice, right? That they do not have the access to the resources. We can talk about many of those underrepresented that are very present, not just in this room, but in our communities, you know, the Black, Hispanic, LGBTI communities, women and children, veterans. If we start thinking in terms of different groups and marginalized groups, they are not necessarily receiving the same. And I think it goes back to understanding the failures within the systems that might not have provided those same resources for all in the room.
Well, thank you. I think we could have spent probably the night with each of you in your particular areas. It's good to get to know you. And we're now going to have Elizabeth come up and we'll turn it out into the panels. And this has been a fun series. And I know the discussions are the most exciting part of the night. So, Elizabeth, thanks for having us here and thanks for being on the panel.
Thank you all so much.